Okay, Shireen. I think it's 5 minutes past. I see the attendees, the ticker is ticking slowly. So I imagine everybody who wants to attend the webinar is already here this morning. So from my side, ladies and gentlemen, thank you so much for your time. My name is Rian Oosthuizen and I'm from NMG. We are very fortunate today to have a big panel of some of some of the experts at Discovery Health to talk to you about the personal health pathway and the personal health fund this morning. So I'm going to welcome all the panelists. Shireen will be doing most of the talking, but she'll be supported by it's an impressive panel. Shaheen, Darshan, Esther, Yolanda. Make sure I don't miss anybody. I think that's the panel that's there. Thank you so much for your time. Shireen, thank you very much for your time. Ladies and gentlemen, we won't keep you long this morning. Shireen is our corporate health manager at Discovery Health in Cape Town. She's the person that helps us if there's any major queries similar to Shaheen. They support us immensely. So thank you very much, Shaheen. Thank you very much, Shireen. Thanks for your time this morning. This morning's webinar is going to be on the personal health pathways and how you can access additional funds in your personal health fund by following the personal health pathways. So over to you, Shireen. Thank you so much for your time this morning, and I look forward to also learning some more about the personal health pathways. Thank you.
Thank you, Rian, and thank you everyone again for making the time to join. So we always start off with what our core purpose is, and that is to make people healthier and enhance and protect their lives. And as we speak about the personal health pathways, you'll see how that product is centered around our very core purpose. And everything that we do, this is essentially the heart of what Discovery is all about. It's to make people healthier. So I have this QR code here. If you've not downloaded the Discovery Health app already, now is your opportunity. So you can take out your phones, you can scan to download the Discovery Health app. If you have the generic app that has your vitality, life details, etc., this is a different one. So just to give you some information on personal health pathways, it is a Discovery Health medical scheme benefit. It does not come at any cost for activating this benefit, and you do not need to have vitality. You will see as we go along in the session that there is a component of vitality. So we take the vitality shared model in terms of vitality active rewards, and it's incorporated in here, but you do not need to be a vitality member to access the personal health pathways. And this is available to all members over the age of 18. So I do have a video that I'm going to show you that will give you an idea and give you some sort of understanding of what personal health pathways is and how it looks.
Personal Health Pathways helps you take the next best step toward better health. It turns data and clinical science into simple, everyday health and exercise actions and rewards you for them. With millions of next best actions completed, it's becoming more precise, more personal, and more rewarding. We've now added Sleep Actions, a world-first feature that uses your Vitality Sleep Score to guide better sleep through personalized weekly goals and rewards. And we're going beyond priority health actions with health challenges, multi-week programs tailored to you, from sleep tracking to glucose monitoring. Complete challenges, earn weekly rewards, and unlock up to 1,500 Rand in your personal health fund. Brought to you by Discovery Health Medical Scheme. Start the year strong with up to 1,000 Rand in your personal health fund by completing your health check and linking your device. Then grow your fund up to 24,000 Rand through ongoing healthy actions. Personal Health Pathways is redefining personalized health. More precise, more personal, more rewarding. Your next best step starts here.
So that gave you an idea of what personal health pathways are. It is a dynamic, personalized pathway that we provide members to take steps to better your health. So we take the guessing work out of navigating the complex healthcare system by giving you actions to do, and it is personalized to your clinical and lifestyle profile. So I'll give an example. If I'm a 40-year-old female and I've never gone for a mammogram, my next best action would most likely be to have a mammogram. And I could have a friend, same age, but she's maybe gone in the last year. She would get a different action because it is based on your clinical and lifestyle profile. So how does this look? We are introducing a sleep ring in the next couple of months. So at the moment, you'll have a health ring and an exercise ring. You'll complete your next best action. So you close this ring, you get rewarded when you close the ring, and then you also accumulate funds into your personal health fund. So let's unpack this. So you complete your actions. At the moment, if you access your app, you'll have 2 rings and you'll get 3 actions. So 2 health actions and 1 exercise action. Once you complete the action, it contributes to closing your ring. So not all actions closes your ring fully. The health ring is the ring with the heart, so the darker blue ring, and your exercise ring is your lighter blue ring. Your health actions will encourage the completion of clinical screening actions. So, for example, your mammogram, pap smear, prostate tests, etc. And your health action displays a date by when the action must be completed. So, it's not going to give you a couple of days, it will give you a period of, let's say, a couple of weeks to complete a specific action. And each action will close the ring by a defined amount. So it either closes it halfway or it can close the ring fully. With your exercise actions, this is aligned to your Vitality Active Rewards. So those who participate in the Vitality Active Rewards, this will be very familiar to you. Encourages your lifestyle actions, so exercising. And here you have a weekly goal and you'll close your ring every week. Then we also introduced personal health pathway challenges this year. So there'll be 3 types of challenges. The Better Health Challenge is for those members who are diagnosed with diabetes and blood pressure. So here it's to monitor your glucose and or blood pressure. And so you build habits to track your glucose and your blood pressure. The Move More Challenge, the first one is to get members started and get active. So here we support new or unengaged members to start exercising. And then those that have shown an interest in it, we want you to form a habit. So the second challenge there is to remain consistent with your exercise program. When we introduce sleep, there will be a sleep challenge. So the first part of the challenge, apologies, is to link your device and track your sleep. So here we can build your base sleep habit. Once that is formed, the second challenge would then to improve your sleep and get better sleep quality patterns. And with the health challenges, you will get a reward for each week that you complete the challenge, as well as earn into the personal health fund once the challenge is completed. So just to give you an idea of what it looks like, you will be able to see your personalized challenges for the year. The challenges that we recommend is again based on the challenge that will have the highest impact on your health. The series can extend between 5 and 10 weeks. You'll be able to track your process on the challenge dashboard, and every week that you complete the challenge, you will earn an instant reward and then unlock up to 1,500 Rand when you complete the challenge in your personal health fund. So how are these actions funded? And I know it's a common question. If I need to go for a mammogram, how is that covered? So the personal pathways is designed to help members get healthier and understand their health status by completing these actions. So 92% of these next best actions is risk funded benefits. So this is paid from the scheme and not from your day-to-day benefit. There may be actions that we recommend that are appropriate for your peace of mind or for early intervention that doesn't have risk funding benefits. And I'll use myself again as an example. Going for my dental screening, that based on my day-to-day benefit. So we'll use your medical scheme benefits where available for those healthcare services. If you have funds already accumulated in the personal health fund, when this claim comes through, we can fund these services from the personal health fund. The system, however, is built with flexibility, so you are able to dismiss or snooze an action if you don't have the funds or you do not wish to pay out of pocket for that particular action. So you have the ability to snooze or dismiss and then wait for your next action to populate. So when it comes to the rewards, you'll get rewards for closing both your health ring and your exercise ring. Your health ring, you can get an instant reward in the form of a voucher. So in these examples, it's a Woolies, Checkers, discount voucher. You have the option to keep the miles. You can spend the miles in the Vitality Mall, or you could save those miles for when you feel like making a purchase and then spend it at the time of your purchase. For your exercise ring rewards, once you have closed your exercise ring, you have the option of selecting an instant reward. Here it's Vida, Kuwai, the Move to Give campaign, etc. Or you can wait for a Wednesday, we call it Rewards Wednesday, where you can play the game board and you could then reveal Discovery Miles. So that means you're converting your instant reward into a game board play so that you can win some miles. And again, you can spend the miles in the Vitality Mall or you can save it and use it later. So we've seen exceptional activation and engagement since we launched this last year. 572,000 members have activated personal health pathways. We've had more than 884,000 health actions completed, with 4.4 million exercise actions completed and 63 million rand earned in rewards. So in addition to the instant rewards that you get for completing your health and exercise actions, you also get additional Discovery Health Medical Scheme benefits in the form of the Personal Health Fund. So once you complete actions in the Personal Health Pathway, you earn funds in the Personal Health Fund. So let's unpack this for you. So this just gives you this video here. Let me just display, apologies, is what it will look like on the app at the moment. So here you have your Nespecs health action. So it's go for a mammogram or collect your medicine. And you'll see there's a due date. And this is your exercise actions that needs to be completed for the week. If I'm opting to go for the mammogram, it will give me the date by which it needs to be completed. You will also have a how to complete this action, frequently asked questions, why it's important, which benefits. You're also able to make an online booking if the facility has that available. Then the way in which we know you've completed an action is when the claim comes through. So once the provider submits the claim to us for, I'll use again the mammogram, for the mammogram, and we have that on system, it automatically links to the personal health pathways and it closes your action. You'll then get a notification that the action has been completed as a result of the claim that we received. So you can see your ring turns to a solid blue line. You'll get your congratulations message and you'll be able to view your rewards. So you can choose a voucher here. We're selecting Woolies and you'll get your QR code. And then you'll see a new action is then created by having to visit your GP in this instance. Exercise, it will give you how you can earn this goal and more ways to get active once this is complete. So I'll just pause here quickly. So you have to have your device linked to the app. So you'd need to ensure that you enable the appropriate tracking as well in order for us to be able to close your exercise ring. So here your exercise ring is complete, or your exercise action. You'll get your congratulations email and you can choose your reward. We're choosing Vida. And here you'll see you have new actions that's available to you. You'll also be able to view your vouchers in the wallet so that you can scan when it's time to purchase. So that is how the app currently looks. When we introduce sleep, you'll see a third ring that will be available to you. So the personal health fund is made up of three components. The personal health fund is used to fund for day-to-day benefits. So members who activated the personal health pathways last year, they enabled their physical and sleep tracking, as well as completed a health check in 2025, would have received 1,000 Rand advance by the end of January this year. So members would have started the year with personal health fund if they met all of those three metrics in 2025. Then the base of the personal health fund is made up of the actions that you complete. And then with the challenges, you can double your personal health value by completing any challenges, and adults can complete 2 challenges a year. So I know the slide looks very busy. This gives you the limits of the plan as well as per policy. So let's just use myself again as an example. If I am on a classic smart plan, I would have earned an advance of 1,000 Rand. So I've received that already. And then my base allocation is 2,000 Rand per adult and 1,000 Rand per child. So if it's me and 2 children, it means I can earn 4,000 Rand in the personal health fund for the year. And then I can complete 2 challenges, which gives me an additional 2,000 Rand. So your limits are dependent on your plan type and your family size, and anything that you accumulate in the personal health fund is used to fund for day-to-day medical expenses. So think GP visits, dentists, medication, a physiotherapist. So essentially anything that is typically paid from your medical savings account, the personal health fund can be used to fund for those services. How do we accumulate this? So each health action accumulates 500 Rand. If there is no health action, your exercise actions will accumulate 100 Rand every week if you complete that. Or if you complete your sleep action first, you'll accumulate 100 Rand. Once each adult has completed 2 actions, the children's proportion is immediately activated or accumulated. So remember, this is only, the personal pathways is only for those over the age of 18. So therefore, when the 2 adults complete 2 actions, the children's portion is automatically unlocked. And the member can complete 2 personal health challenges for the year. And as explained, any accumulated funds can be used to cover your day-to-day medical expenses. What is nice about the personal health fund is that if you have a balance available there and a day-to-day claim comes through for processing, we'll take the funds from the PHF first, or the personal health fund first, before we take it from your available medical savings account. So this is a nice way to preserve your medical savings account balance. For those members that are on the KeyCare, Smart Saver, or Smart plans, your risk-funded day-to-day benefits will apply first before the personal health fund. So let me just give you an example. If I am on a KeyCare plan, I have a specialist benefit and I've been approved for specialist consultations. The claims will pay from the specialist specialist benefit first. Once that is depleted and I continue with my specialist consultations, that will then be funded from the personal health fund. Any member on the policy can use the personal health fund. So I've mentioned I have 2 kids, and let's say we've accumulated our 6,000 Rand in personal health fund. My youngest can take the entire 6,000 Rand for services that he needs. So anyone can use the personal health fund on the membership. What is important is that funds need to be used within the same calendar year, as the fund resets on 1 January each year. So that's also quite important to remember. Then for new joiners, you have a chance to double your personal health fund in your first benefit year. So members that join from 1 January and who activate personal health pathways can earn up to double their allocation. How does this work? You download the Discovery Health app, you activate personal health pathways, you complete the high value tile action within 90 days, and you'll accumulate then all that funds that is due to you based on your plan type. And then once all the adults on the membership has completed the high value tile, the fund allocation for the children will be available immediately. So the same values of the individual and policy personal health fund limits is applicable to the new joiner benefit as well. With the new joiner benefit, you can use it in this benefit year and the next. So this is only applicable for your new joiners. You can also continue accumulating new members. You don't have to stop just at the high value tile. You can still complete your actions and still earn throughout the year your base personal health fund. And then that's the end of the session. I'm going to put up the QR code again for anyone who would like to download the Discovery Health app. Deanne, is there any questions?
Where do I put on my camera? Here we go. There's so many platforms these days between Teams, Zooms, Google Meet. To find the correct button is always a challenge. Yes, there's been questions, and thank you so much to both Esther and Shaheen that's answering the questions. I see one of the most predominant questions, I see we've still got about 5 minutes, is the multiple apps. I know that has been addressed. Yes. So if you've got the Discovery Health app with a yellow flower or leaf, yes, or whatever emblem is, that's the old app. The new Discovery One app is light blue, and then if you have the banking app, it's the purple little flower. Yes. So we do understand there's some challenges with that. I see Esther has answered that. It's definitely something that the scheme, well, the whole Discovery group of companies are addressing. But in terms of personal health pathways, if you wish to activate and utilize that, it is using the latest health one, which is the one with the little blue picture. That is the app that needs to be used. There are some technicalities, with the various apps. What we have found is the easiest way is to phone your digital call center. And they are the cleverest people when it gets to these apps to get some of the matters resolved, not all of it, like Esther mentioned. But maybe if you are struggling with your apps, a call to the call center will resolve it in most cases. That's the one thing. There was also an interesting question with regards to you are motivated to go and do a particular event, or you're motivated in a particular path, and then the service provider charges more than the scheme rate. And then it's the gentleman says, or the lady, I'm not too sure because it's anonymous, said that it's counterproductive because now you're going for R1,000 event, and the Discovery Health rate's only 500. But the way I understand it, if you follow the pathway via the app, you will be directed towards a provider that charges the Discovery Health rate.
So members are allowed to search for a provider that is within our contracted rates, or what we call a designated service provider. So again, if members don't want to go for a particular action, they can, it's built with that flexibility that you can snooze or dismiss the action. So the action that we recommend is for you to have peace of mind. So the 92% is risk funded. So think if I'm a chronic patient and I haven't been for my 6-month checkup, and that is what's prompted, my consultation is going to pay from the chronic illness benefit. But something like dentistry, we know we have to go twice a year. If that comes up and you don't have the funds in the savings, or you don't have to pay out of pocket, you can snooze or dismiss that action and not go for it. But it's all designed to give you the peace of mind to see if you are at risk of any condition, because we know the importance of detecting something earlier. For an example, the success rate for early detection of breast cancer, prostate cancer, etc. So that's why we say that the tests or the actions is there to see if you are at risk of anything and to give you that peace of mind. But you have the option to snooze or dismiss.
And then another interesting question, and I've had a few of them, is in terms of the devices. Now, obviously, when we speak about devices, there's two legs to the devices question. There is if you've got Vitality and you've got active rewards and you wish to claim active rewards, there are several devices that you can use to track your exercise
So,
events.
yes. Yeah.
Okay, so that's the one component. That's I have vitality. I have a device that measures my activity. The second device portion is in terms of sleep. Now, when that sleep ring appears, at this point in time, the answer is the only devices, the way we understand it, that will be able to measure your sleep at this point in time. Obviously, further development will happen. Is, if I understand it correct, the Garmin watch and the Apple smartwatch.
Samsung as well, and then the
Okay.
Oura Ring. Yeah.
Okay, so you've now got 4 already. The big
Yes.
one I have often received is Huawei. Everybody wants to know
Oh,
when they can
yes.
use their Huawei. Okay,
Yeah.
so just in
So,
terms of the question, in terms of that activity tracker, at this point in time, it's important to remember that there's 2 activity trackers. The one linked to your health events, if you've got vitality, and then the sleep when it's there. At this point in time, it's not going to be all of the same activity trackers at the moment, but there's already more than the last feedback I got. The last feedback I got was in January, and it was only 2 at that stage. I hear we've already now gone up to about 4 activity trackers.
So for those that have vitality, there's nothing additional that they have to do in terms of the exercise ring. It's the same that they are used to. So it's just for members that aren't on vitality, they get to experience what that vitality active rewards is in terms of that exercise ring. So for members that is already active on vitality, that stays the same in terms of meeting their weekly goals. The ring stays the same and it's integrated there. But you don't have to be a vitality member, right, to participate. So the personal health pathways uses the element of vitality active rewards for the exercise portion. So if you are linked, your device is linked, it's synced and everything, it will then be synced to the personal health pathways as well. But like you mentioned, when sleep comes in, it's only those 4 devices that is enabled for sleep tracking. But for the exercise tracking, if you're using it for vitality, it carries on like normal.
Okay, great. And then I think I'm going to do one or 2 more. Thank you once again for the panel answering, because we do get this quite often. You have mentioned the fact that if you don't follow your pathway, so you've said this is your event, you need to go and do it. If you don't do it or you snooze it, it will come up later again. So there was a question about, I didn't do it last year, will I get it this year? Yes, if it was a requirement last year and you didn't do it, it will probably come up this year again and request you to do it, so you're not missing out on that. The other one that we often get is, and I see it was in the questions as well, let's for example say during the year I'm going to get a message to, like, I have to go for my prostate. I know I was told last year, I didn't go when they told me to go, I need to go this year. So let's say I go now and I go to a network provider. So I go to my Premier Plus GP, that is my primary care provider. I've nominated them. He does the prostate blood test. Will I still get the personal pathway or personal health fund money, even though I wasn't prompted by the phone to go and do it?
Yeah. So you only get the funds if the prompt is there, if the action is
Okay.
there, and you then go. So if you've gone, like let's say it's a coincidence and you went last week and that wasn't an action, then you won't get the personal health fund for that, but there'll be other actions that you can complete.
Yes.
Yeah.
Understood. Because that's quite a question you get often, and I think I'm going to do 1 or 2 more. There was an interesting one here about adults. Where is that question? Answered that. Sorry, I can't get that one. That was a very good question.
About adults, let's
It was
just
about
unpack.
2 adults. I think they may have been answered subsequent to it popping
Okay.
up. Yeah.
Okay. So the personal pathway is, just because we have a bit of time, is available to everyone that's over the age of 18, and each one has their own unique pathway. So if I have a spouse on my membership, chances are we're not getting the same, because he will have different stuff based on his clinical profile compared to me. But we both need to complete 2 actions to unlock our children's portion. So again, if it's me, I have 2 kids, it's 1,000 Rand. We both have to complete 2 actions to unlock the full child allocation. But we both will have our own separate apps and our own separate pathways because we are different and have unique clinical and lifestyle profiles. So whatever the question was on adults, that's basically how it works with adults in the personal health fund. Let's just see.
So I see there's some Discovery Health Medical Scheme questions here as well. So thanks for the question, but I don't think we'll be able to get to the Discovery Health questions. I can imagine if we have Discovery Health questions today, we're going to sit here the whole day.
Yeah.
So please, for those who are on the webinar today, if we don't get to your question today or we don't answer it today, please reach out to your NMG consultant. You can basically just copy and paste the message you have here, pop it off to your NMG consultant, say you were in the webinar this morning and you posed a particular question that wasn't answered. And yeah, we'll definitely get the feedback from Shireen and the team.
Yeah. And Rian, is the recording for this going to be made available for
Yes,
your...
that's one of... Yeah, that was going to be in my closing remarks. So I think...
Sorry.
No worries. Let's give everybody 25 minutes for the rest of their day back. Everybody values time. So, ladies and gentlemen, thank you very much for your time. As I mentioned, if your question wasn't answered this morning in the chat, please just copy and paste it and send it off to your NMG consultant, and we'll get the answer from Shireen and her team. In terms of the recording, yes, the session this morning has been recorded, and everybody who attended, I think, well, we'll probably distribute the link to everybody within our client base, not necessarily just those who were. So we will distribute the link for this morning's recording if you want to go and watch it again. But yeah, from NMG side, Discovery, Shireen, thank you to your team. Thank you very much for your time this morning. To all of our clients and our members who attended this morning, thank you so much for your time. Thank you for making time on a Friday morning to join us for this webinar. It's really a massive honor for us, and we are really thankful that so many of our members made the time to attend the webinar this morning. Thank you very much for your time. Yeah, all of the best for the rest of the Friday and the rest of the weekend. And over to you, Shireen, if you want to just close it off.
Thanks. I just wanted to also just give my thanks to everyone who took the time to join the session. And important, activate personal pathways and go for your health check. That's it from me.
Thank you so much. All the best.
Bye.
Bye-bye. Bye-bye.